And there are a lot of state legislatures, you probably know your local calendar better than I do, where the legislative session is coming to an end this month, next month, and you're going to see some decisions, in the next month or two about whether governors sign exchange legislation, veto it, try and change it. So there really are a lot of good dates to be watching, just over the next few months. And what happens now is very consequential over the next few years. If your legislature only meets every other year, they're meeting right now in 2011, they won't meet until 2013, and they don't set up a health exchange now, they're kind of out of luck. They're going to miss that date when the HHS is to certify their exchange. So really this legislative session is a crucial one to watch in terms of where states are going on health exchanges. And just a few interesting state stories and to give you a sense of kind of what's going on out there. There were 7 states that were chosen as early innovator states in February. I can run through the list quickly. If you want any more information on that, just come up and ask me. The 7 states were Oklahoma, Wisconsin, Oregon, Maryland. It's a challenge to make sure I remember all of them. Kansas is another good one. Massachusetts is leading the consortium of states out in New England. And the last one, Missouri. No, Missouri. Oklahoma. Okay. Oregon. Okay. Okay, I will get the complete list. Anyways, Oklahoma just yesterday sent back their $54 million early innovator grant. The governor was under a lot of pressure from local Republicans who were saying, don't take this money, we don't want this, back out of Obamacare. And 2 months ago, the governor was saying this grant is great, it's going to enable us to set up our own state exchange. Just yesterday, she said, this is going to help us stop health reform. So it's a very volatile environment. Things are changing. Florida has sent back some money. Wisconsin has sent back some money. New Hampshire is looking at sending some stuff back. So day by day, there's so many things that are developing very quickly. And really, for insurers, for patients, for hospitals, it really matters to them what's going on. And they'd like, with their businesses, some kind of stability in terms of projecting where things are going. So I think there are a lot of really interesting stories around these exchanges that are not being told that are great ones to get into. They'll have a lot of widespread interest for readers. And another key place to focus on exchanges is how the governor and the legislature are working together, because there's a lot of tension there, particularly if any of you are in states where you have divided government, like we have out in Washington. It's kind of a similar amount of gridlock. Montana, for example, you have a Democratic governor, Republican legislature. The Republican legislature will only pass a bill to say we will not set up a health exchange. The governor out there will only sign a bill to say we will set up a health exchange. Clearly there's very little middle ground between those. In Virginia, for example, they passed some exchange legislation. The governor came back to them and said, no, I want you to make the restrictions on abortion in our exchange, more restrictive. So they're working through that issue right now. So there's so many kind of legal, lobbying, business stories that are going on around the exchanges, and definitely a great place to focus. So that's, I would say, story number 1 right now. And then we just quickly go through a few other things to be watching. Insurance rate regulation. If any of you are freelancers and are in the individual market, rates have skyrocketed recently. And the Obama administration was very happy to point out, rate increases in excess of 30–40% in California during the health reform debate. Now the health reform law gives both HHS and states some additional powers to crack down on rate review. And I would argue has also just made insurance commissioners, who kind of run the whole insurance scene, more aggressive in pursuing reviews and asking insurers to scale back the rate hikes. That's just kind of created an atmosphere where insurance commissioners are taking an increasingly regulatory role in asking for more data and reviewing rate increases. What the health reform law did is said that any rate increase over 10%, which is a fair number in the individual market, will be reviewed to see if it's unreasonable. What does unreasonable mean? I think insurers and consumer advocates have some pretty different definitions. HHS not wanting to get into a very thorny issue, basically left it to the states to determine their own definition of unreasonable. So each state by state will kind of vary what criteria they're looking at, although if you would like the thrill of reading the insurance rate regulation, some of the criteria are laid out there. So that's one thing, to definitely keep an eye on is, what rates are being reviewed. This is all going to work through your insurance commissioner's office, and I would suggest definitely getting to know them since they're very intricately involved in the health world. And so just keeping an eye on, whose rates are getting reviewed. What are insurers doing to react to that? Are they, submitting lower rate hikes because they just know it can't get through? Are they changing their business model at all? I think it should be interesting to see kind of what the business story is in reaction to these new regulations. Another area also in the insurance world that seems wonky and has been a personal favorite of mine to cover because I think it actually is very interesting is the medical loss ratio, which is MLR in kind of health speak, and it's the requirement that insurers spend in the individual market 80% of premium subscriber dollars on medical costs. So they can't, and the rest of it can go to administration or profits, but 80% of what we're all paying them has to go to things that are medical. There's a very long process to determine what is medical, what isn't medical, is a nursing hotline, for example, medical. They issued that regulation in December. Now there's a lot of states who are saying, this regulation is going to kill our insurance market. Like, our insurers, they can't spend this much. They will just say, whatever, we're going out of business because of this regulation. So we already have 9 states that have applied for waivers from this provision, from the medical loss ratio. I will not try and list all of them, but I do know a good number, so if you'd like to talk to me afterwards, I can probably tell you where your state is on the issue. One has been approved. The state of Maine was the first application that Health and Human Services decided on, and what they decided in that case was Maine insurers are only going to be required to spend 65 cents of the dollar on medical costs. The other 35 they can spend on whatever they want. The reason for the Maine decision was there are only basically two carriers that dominate their insurance market, and one of them had said, we're out if you pass this. Basically said, if this comes into effect, we're not selling in Maine anymore. The others, so that was we kind of expected Maine to get its waiver. The other states are going to be more interesting, where they have more carriers, will be less impact if one of them leaves. And there's also a philosophical question of, does HHS want to be in the business of keeping insurers who are spending, 60 cents of subscriber premiums on medical costs? And there's been a lot of consumer advocacy around not issuing these waivers, keeping these regulations in place. But, 9 states have applied. I know about 5 or 6 who are planning to apply soon. So it's clear there are a lot of states that are, very much interested in getting these exceptions from the health reform law. And it's a thorny issue for the Obama administration. How many exceptions do you make? How many waivers do you give? While also saying this is a great law and it's doing great things. So those are the 3 big health reform issues I'm watching in the States.